Imagine you're talking to someone. Suddenly, one side of their face starts to droop. They can't smile properly. Their speech sounds different. Your first thought might be, is this Bell's palsy? But what if it's actually a stroke? Both conditions can cause facial weakness. They can look very similar. But one of them is a medical emergency where every minute counts. In this video, you'll learn how to recognize the differences between stroke and Bell's palsy, why they happen, and when to seek emergency medical care. Let's make medicine simple. Whether you're a patient, a medical student, a physiotherapy student, or simply curious about the human body, you're in the right place. Welcome to MediLearn Hub, where we make medicine simple. If you enjoy learning with us, consider subscribing. Now, let's begin. Let's start with stroke. A stroke happens when the blood supply to part of the brain is interrupted. Without oxygen and nutrients, brain cells begin to die within minutes. There are two main types of stroke. The first is an ischemic stroke. This happens when a blood clot blocks an artery supplying the brain. It is the most common type. The second is a hemorrhagic stroke. This happens when a blood vessel in the brain ruptures and causes bleeding. Both types damage brain tissue. If the area controlling facial movement is affected, one side of the face may become weak, but a stroke usually affects more than just the face. It may also affect the arm, the leg, speech, vision, balance, or coordination. That is why recognizing the warning signs early is so important. Now let's look at Bell's palsy. Unlike a stroke, Bell's palsy is not caused by a problem in the brain. It happens when the facial nerve becomes inflamed. The exact cause is not always known, but it is often linked to viral infections that can trigger swelling around the nerve. When the swollen nerve passes through a narrow, bony canal, it becomes compressed. As a result, the muscles on one side of the face become weak or completely paralyzed. People with Bell's palsy may suddenly notice that one side of their face droops. They may have difficulty closing one eye. Smiling becomes uneven. Food or drinks may leak from one side of the mouth. Some people also notice changes in taste or increased sensitivity to sound. Although Bell's palsy can look frightening, it is usually not life-threatening. Most people begin to recover within weeks, and many recover completely over time. Here is where many people become confused. Both stroke and Bell's palsy can cause facial weakness. At first glance, they may look almost identical, but the reason behind the weakness is completely different. In a stroke, the brain is injured. In Bell's palsy, the facial nerve itself is affected. This difference changes the pattern of facial weakness. Understanding this pattern can help explain why these conditions are different. However, it is important to remember one thing. You should never try to diagnose yourself based only on appearance. Any sudden facial weakness should be treated as a possible medical emergency until a healthcare professional says otherwise. Now let's compare the facial weakness. In Bell's palsy, the entire side of the face is usually affected. The person often cannot raise their eyebrow. They cannot fully close the eye. The forehead appears smooth. The mouth droops on the same side. In many strokes, the weakness mainly affects the lower part of the face. The person may still be able to wrinkle the forehead and close both eyes because the forehead muscles receive signals from both sides of the brain. However, this pattern is not perfect in every stroke. Some strokes can affect the forehead too, depending on the location and severity. That is why forehead movement alone should never be used to rule out a stroke. If someone suddenly develops facial weakness, especially if they also have arm weakness, difficulty speaking, confusion, vision changes, severe dizziness, or loss of balance, treat it as a possible stroke and seek emergency medical care immediately. Remember this simple rule. When in doubt, think stroke first. When someone suddenly develops facial weakness, remember one simple word: F-A-S-T. The letter F stands for face. Ask the person to smile. Does one side of the face droop? The letter A stands for arms. Ask them to raise both arms. Does one arm drift downward or feel weak? The letter S stands for speech. Ask them to repeat a simple sentence. Is their speech slurred, difficult to understand, or unusual? The letter T stands for time. If you notice any of these warning signs, call your local emergency medical service immediately. Do not wait to see if the symptoms improve. Do not try to drive yourself if emergency services are available. In stroke care, every minute matters because brain cells are being damaged. Remember this phrase, time is brain. Now let's compare these two conditions side by side. A stroke begins in the brain. Bell's palsy begins in the facial nerve. A stroke may affect the face, arm, leg, speech, vision, or balance. Bell's palsy usually affects only the muscles on one side of the face. In Bell's palsy, closing one eye and raising the eyebrow are often difficult. In many strokes, the lower face is more noticeably affected, although forehead involvement can occur depending on the type and location of the stroke. A stroke is a medical emergency that requires immediate assessment and treatment. Bell's palsy also needs medical evaluation, but it is generally not the same type of emergency. One important message to remember is this: if you are unsure whether it is a stroke or Bell's palsy, treat it as a possible stroke and seek emergency medical care immediately. How do doctors tell the difference? The process begins with a careful medical history and physical examination. Your symptoms, how quickly they started, and the findings on examination provide important clues. If a stroke is suspected, brain imaging, such as a CT scan or MRI, may be performed to help identify the cause. Treatment depends on the type of stroke and how soon the person reaches medical care. For Bell's palsy, treatment may include medications such as corticosteroids started early, eye protection if the eyelid cannot close completely, and rehabilitation when appropriate. Many people with Bell's palsy recover well over time. Recovery after a stroke varies depending on the area of the brain affected and how quickly treatment begins. Before we finish, here's an important clinical pearl. Many people believe they can tell the difference between Bell's palsy and a stroke just by looking at the face. That is not always true. Some strokes can look very similar to Bell's palsy. That is why healthcare professionals consider the whole clinical picture, not just one side. Here is another myth. If the face is the only thing affected, it cannot be a stroke. This is false. Even if facial weakness appears to be the main symptom, a stroke is still possible. When facial weakness begins suddenly, it should always be assessed by a healthcare professional as soon as possible. When in doubt, think stroke first. Let's review the key points. A stroke happens because part of the brain loses its blood supply. Bell's palsy happens because the facial nerve becomes inflamed. Both conditions can cause facial weakness. However, a stroke is a medical emergency. If someone suddenly develops facial weakness, especially with arm weakness, speech problems, vision changes, dizziness, or a loss of balance, seek emergency medical care immediately. Early treatment can make a life-changing difference. If you found this video helpful, please like, subscribe, and share it with your friends and family. Your support helps us create more simple and visual medical education for everyone. If there is another medical topic you would like us to explain, leave it in the comments below. Thank you for watching MediLearn Hub, where we make medicine simple. Stay healthy, keep learning, and I'll see you in the next video.